Okay, we're recording. So I'm Lawrence Yang. I'm a family doctor here in Surrey, British Columbia, at Surrey Memorial Hospital. Have you ever visited British Columbia?
I was in Vancouver in November to
Oh,
visit BC Children's.
okay. You were here just recently. BC Children's is definitely our flagship in healthcare. Culture-wise and leadership-wise, patient experience-wise, it's the place to go.
Yeah, we're designing a new department, so we went to check it out. It's definitely very fancy.
That's so cool. I've only spent a little bit of time there, but most of my time I'm in Surrey, in British Columbia, at Surrey Memorial Hospital, where I'm the head of family practice there, head of the department. Uh, I'm a burnout recovery person. I'm from healthcare burnout, and so I say that it's been about 4 years since I've been really getting back into the swing of things and really trying to increase my efficiency and efficacy in delivering healthcare as a primary care doctor who works in both the clinic and the hospital.
Mhm.
So I would like to tell you a little bit more about the background of this podcast. So coming out of that burnout, I realized that so much of why I had gone into what I would define as burnout, where I was really stressed out and not able to really respond to my maximum capabilities, was because I wasn't reaching out for help. I wasn't connecting with people. I wasn't able to be vulnerable to tell people, hey, I'm not able to manage this particular case by myself, this particular clinical case. I'm not feeling like I remember everything from residency, and I wasn't calling on my colleagues enough. And so out of that, I realized that many of us do that, and that we have this toxic perfectionism that we put on ourselves, that we can't ask for help and we got to know everything. And born out of that understanding, I knew that shifting the culture of healthcare has to do with being open about our needs and our vulnerabilities, so that we can bring in that team aspect, which is required for excellent care delivery. And you work in the emergency room, and it's all about teams. So you know a lot about that, huh?
Yeah, I work in pediatric emergency medicine.
Mm-hmm.
I did my residency in just plain old emergency medicine, but not long after I finished my residency, I kind of shifted gears into pediatrics, and so it's been over 10 years since I've done a shift in an adult hospital.
Mm-hmm.
And in my department, I'm the chief of our department, and
Mm-hmm.
we're in the middle of the same thing you guys are in the middle of. We're in the middle of COVID. Before that, we were planning a new department, so we were into schematic design and redevelopment and redesign, and that's sort of all abruptly come to a stop while we've had to shift gears.
Mm-hmm. In your training, in your residency, had you ever explored the concepts of, human factors design, patient flow through the hospital? Was that in any part of your training in undergrad?
It was like a little bit, because
Oh,
actually, when I was a resident, the hospital I was working in was building a new department. And
oh,
so when I finished residency, the first shift I did as a staff person was in a totally brand new department. But I think when you're a learner, you're in a different kind of a bubble. So I saw it through the eyes of a learner and not through the eyes of like a department head. So things when I look at them now, it looks really different than it looked to me then.
mm-hmm. I've been a department head for about 2.5 to 3 years now, and it's been a big learning curve for me.
Mhm.
Learning about what leadership means, and learning how effective leadership really is about how I lead myself, how I show up. Have you had any like official training in leadership training, or do you just take it in by osmosis and smart?
uh, I never actually thought that I would be the leader of the department. Is definitely not something I had set out to do. So I'm definitely one of those classic medical accidental leaders. Um, I did take on a leadership role under the guise, when I didn't realize is that the chief of our department at the time, who had been chief for quite some time, sort of tapped me to assist her. And so I said, oh, I will do this to help her, not really thinking, oh, somebody is preparing me to possibly take this over. So, the day that she sat me down and said, so I'm not going to continue in this role. I'm hoping you will do it. I was very surprised. I might have been the only person who was surprised. But in the meantime, I was doing some leadership courses because she told me they would be helpful to me. So our provincial society, the Doctors Nova Scotia, had a physician leader development program. It was a 1-year program. And so I did that 1-year program, and it has helped me immensely in very many ways. But in particular, right now, I have these moments where I can vividly recollect something we discussed and something we did and say, this is the moment. This right here is the moment, right? The whole concept of VUCA, I was like, well, here it is. COVID is VUCA.
Tell me again about VUCA, because I don't know it, and some people might not understand it too.
So VUCA: volatility, uncertainty, complexity, ambiguity.
Sounds like healthcare.
So it sounds like healthcare in general, and I would say COVID in particular. We are in uncertain, ambiguous, complex, volatile times. Like that's, I think, the defining feature of what the pandemic is, and people so wish they could have some certainty. When is this over? How long is it going to last? What are we going to do? And really, we've been changing the answers, quite regularly.
Yeah.
And if you think then shift and change. And for some people, that is really, really hard.
Yeah. In my community, there are many of my colleagues who really, much of their pride and their self-assuredness comes from being able to know exactly what to do and to know the evidence. And we're in that state currently of emerging evidence, of emergence of guidelines. And so things are changing, and it's really destabilizing for a lot of people's, I think, self-worth at the core of it. Is that what you're seeing in Nova Scotia too?
Well, I think physicians, they put themselves in a position where it's not okay to make mistakes. I mean, obviously, nobody wants to harm anybody, but that's that perfectionism that you mentioned before. It's based on a need. I think it comes from a good place. People don't want to hurt anybody. They want to do right. They're not trying to be perfect for the sake of being perfect. But obviously, everybody, is going to make mistakes from time to time. And we hold ourselves to this very high standard. And so in general, we crave certainty because we want to know, what are the answers? What is the right thing to do? When I have this patient with the low oxygen saturations, can I put them on high flow oxygen? Or am I going to be harming my team if I do that? So, people want some certainty about what's safe and what's not safe, and what am I directed to do in this situation? But in reality, the answer has shifted. What they told us wasn't okay a couple of weeks ago, now they're saying maybe that actually is the right answer. So it's, we're on this unsteady ground.
And just for some of those listeners who aren't in healthcare, putting high flow oxygen is providing oxygen to the patients at a pretty high rate of flow. And there's that risk of aerosolizing viral particles when we have higher flow blowing into either our nose or our mouth. Is that right? Did I get it right?
Yeah, you got that right. And so for us as healthcare providers, we worry that it puts us at increased risk of inhaling those viral particles and actually getting COVID.
And from what I understand, I think the viral particles, they like to attack some of the pneumocytes, or the cells of our lungs in our lungs. So inhaling it deeply, especially when it's really a light, fine particle that can go deep into your lungs, is really, really risky to our team members. And we know that if some of our team members get impacted, it's almost like again, an exponential risk to us. We lose team members, our shift core group gets smaller, and then our risks increase because there's less people to have eyes on to watch each other. how was that transition into donning and doffing for you guys? Because for many of us, we hadn't had to don some of those personal protection equipment things for a long while. Some of us, was that something that your teams were already really prepared for and did it really well?
Well, it makes everything we did before look foolish and reckless.
Uh,
In emergency medicine, particularly in pediatric emergency medicine, the vast majority of the patients we see have fever and a respiratory illness.
mhm,
And mostly that was things like influenza or RSV, the respiratory syncytial virus, or other kinds of common viruses like colds. Um, and really, we should have been using droplet precautions and masks and gowns and gloves for all of those patients. But we said, we don't need to do that. These are common viruses. And if we did that for every patient, it would take too long and it would waste too much supplies. And so, as recently as 2 months ago, we were walking into a room with a fever and a cough, like the meme with Brad Pitt, from Fight Club, like going in totally bare chested, basically. And now that looks, so foolish. I can't believe we did
mm,
that. It has been a big transition to think about why and how we need to not only protect ourselves, but to protect our subsequent patients, so we're not transitioning that virus from room A into room B when we walk
mhm,
from one room to another. So although we know those personal protective equipment and the rules, we weren't actually applying them before March.
mhm, mhm. In British Columbia, we've had outbreaks in our prison systems, in our long-term care homes, and recently at one of the hospitals in my region. And that's incredibly anxiety provoking for the public as well as the staff there. And I've had patients of mine who work in healthcare and they've been asking for time off because they just don't feel safe. And even though they're young and fit, it's a really tough thing for me to navigate, like how to deal with those issues. Have you seen some of that in Nova Scotia as well?
I haven't personally, because
Mhm,
I'm in pediatric emergency medicine. I
mhm,
haven't had an opportunity to really observe that. I do observe that when people make the decision to come to the emergency department now, it seems like a heavy, weighty decision compared
mhm,
to before people would just come.
mhm,
I've had, people just make comments, I haven't left my house in 2 weeks, or, obviously I'm really worried because I made the big decision to come here today. And you can just tell that just the level of concern, even just about being in the hospital, is kind of scary for people.
mhm. Our hospital census has dropped significantly because of this virus. Everybody is really scared and really delaying their presentation to the acute centers. On a typical day at my hospital, we would see, prior to the pandemic, about sometimes 600 people come through the emergency room, and now we're seeing about 300, 400. So yeah, it's been a significant decrease, and unfortunately, we've had few rare incidences of people actually, uh, succumbing to their illnesses at home, cardiac illnesses, etc., because of that fear. And we're trying to get that public health messaging out there that if you do have an acute issue like shortness of breath or chest pain, please do come to the acute centers. But I know in pediatrics, you probably have a bit of that, but maybe not as much. Eh?
Well, my message to people has been, we are open, we're here for you. If you have an emergency, please come, we will help you, and we will do everything possible to keep you safe.
Mhm. What has been, would you say, the hardest thing for you during this pandemic so far?
The hardest thing is family.
Mm,
Um, so when this pandemic was sort of taking shape in March, I was on a trip to Newfoundland with my family. And so I made the decision to leave the children with their grandparents in Newfoundland.
wow,
And so I have been back in Nova Scotia without them now for 4 weeks today.
wow. So, wow, spending that amount of time away from your kids, and I'm sure your kids they're young. I mean, looking at you, you're quite young too. So, wow. So a lot of FaceTiming with them, a lot of Skype calls, or yeah.
Yeah. None of that is the same as just being
Mm,
there.
yeah, yeah. No, I can't imagine as a as a mom, not being able to be there for your kids while they're potentially anxious about things, and I'm sure they're worrying about you.
They've been good sports, but I just worry. I worry about them. I just worry about them.
Of
you
course.
know, I think that
Hmm.
it's been a nice distraction for my parents.
Hmm.
Um, but I think it's been, I don't know, it's hard. I think hardest on my oldest. He's in high school, and I think it's been hard school wise.
Hmm. He's probably, like, his mind is probably split, worrying about you at the emergency room, and trying to focus on transitioning into a homeschool environment, really, right?
Yeah, like
Mm,
distance learning, sort of, I guess.
yeah. And these days, being a teenager itself is hard enough. There's so many distractions, especially online for young kids and young men, especially. So
Mm.
I can't imagine how challenging that can be. And what about for your teams, the emergency room culture? Have you felt a shift during the pandemic?
I definitely think that I've never seen my team more anxious. Um, Emergency medicine in general sort of has a culture and a reputation for being kind of cool, and sort of having strength under pressure and being able to problem solve and cope with whatever comes their way. Um, but I feel the leveling of anxiety is higher than I've ever seen it. People are
Mm,
just worried predominantly for their personal safety, and many people are worried about the people they love and bringing home an illness to somebody who's vulnerable.
mm,
So I feel like the biggest shift has been just uh, like an undercurrent of fear.
mm. And are there, you spoke a little bit about your leadership training and that year that you did, and that was kind of like, were there kind of like online things that you had to do for that leadership training, and then like in-person residencies? Uh,
It
is
was
that how?
mostly in person. We did have we had a team, like a group, that had to do a service learning project that was longitudinal. And so that part, was small group working together and meeting outside of the actual curriculum of the course. It also included coaching. So you had one-on-one coaching and team-based coaching throughout the year as well. And while it was happening, I felt like I don't have time to do this. But in retrospect, so useful.
Have you
I
found
wish I
your?
knew how useful it was right when it was happening.
I know,
Uh,
right? Always hindsight. Hindsight's 2020. And so you found yourself using some of those coaching techniques?
Definitely. So the coaching, like I was the recipient of the coaching. And in the middle of this, I have gone back to my coach, and I've been meeting with my coach every
Ah,
2 weeks in the last couple months. Um, and he's
mm,
just reminding me of the things that we learned. And like you mentioned, that sort of people being hard on themselves.
mhm,
So when I first met with him in March, he said, what are you doing to look after yourself? And I was like, oh, nothing. And then we got to talking, and he's like, I hear that I hear what you're doing. You're doing this and you're doing that. And he's like, you're not doing nothing. But we have, this tendency to be like tough judges of ourselves. And
mhm,
so I have found, just those moments to take grace and be patient with yourself, and to
mhm,
recognize that you're doing the best you can.
mhm,
Um, and, giving me some structure and context to deal with, missing my kids is helpful too.
mhm. I've I'm part of a book club with a few physicians out here, and it's around a workbook by Dr. Kristen Neff, a PhD,
Yes.
Oh, you've looked at
I
it?
know who she is. So I don't have the workbook. I have the book, The Self-Compassion. Uh,
Mm,
it's brilliant.
yeah, it really is. And I think it should be part of our medical curriculum, because
Mm.
when we beat ourselves up, it doesn't really help anybody, right?
No,
It's not a protective act,
no.
but we tend to go there all the time.
Well, we act like it's important, like you don't want to be too kind to yourself, like that
Mm,
it's harmful to you in some way, or that it's going to give you a big head or something. I don't know what it is that exactly that people think, but if we could teach self-compassion more so than the whole notion of self-esteem, self-compassion is just if you could be as kind to yourself as you would be to the people in your department. You
mm,
would never crush the people in your department the way you would crush yourself.
love that. Yeah. And you were saying, in a team where the anxiety is a little heightened, the fear is heightened, what are some things that you can do or be that helps that as a department leader?
Well, I feel like most of the time you're not necessarily going to know exactly what to do in the moment. And so I think most of the time we need to listen. Um, and we recognize that the fears I have may not be the same as the fears that somebody else has. So to try to just listen and be curious and hear and understand, to see where people are. Um, I don't know how many times in the last few weeks I've said, I don't know what to do. And even if you don't know what to do, just listening can be helpful. And I love the advice about, you get to have do-overs. I had a trying encounter with, someone in my department, somebody who I respect a great deal. I think we were both completely caught off guard, and, and then had like major friction. And the next day, I called her and I said, I don't know what really happened there. Like essentially, like, let's have a do-over. let's talk about it. And I'm generally a person whose coping strategy for conflict is to simply avoid it, because it's very uncomfortable and I don't want to have to do that. But in the last few weeks I've taken the approach, like, you have to just go in there. You have to do it. And you have to face it. If there's a conflict, you can't avoid it. There's no room to avoid it.
Mm,
uh, it's a different world. Whereas in a world where the rate of change is constant and not rapid, you have room to maneuver around things. Right
yeah.
now, we don't have that room to maneuver
Mm,
around things. So when something is difficult, you have to kind of go in and just deal with whatever that difficult thing is. I just find it sometimes it's just very taxing, like emotionally, it's just really tiring.
no, what I hear from you is that it's so important that we lean into those disagreements within our team, and that
Yeah.
we dare to confront and have those dialogues that are so necessary to get to progress,
Yeah.
and to not delay or void or procrastinate around
Yes.
team misunderstandings. I think
Exactly.
that is a key thing in a time of crisis. What was that acronym that you said again? Was it VUCA?
VUCA. Yeah. Volatility,
Volatility,
uncertainty,
uncertainty,
complexity,
complexity,
ambiguity.
ambiguity. Yeah, and in those situations, leaders, we, as part of teams, we got to lean in and say the truth, and open up room for dialogue right away, because often we're actually, the differing parties are actually on the same page. We're just in a misunderstanding,
Mhm.
right? Yeah, the behaviors that we witness, we can assume a lot of things about the behaviors, but the true intentions, the motivations behind the behaviors are in alignment, but the behaviors look disparate. And I think as a leader, bringing that out when we see it in our teams, and when we're involved in it directly, that takes a lot of courage. Kudos on you for leaning into that, and that's really impressive. And Dr. Dan Diamond, which is, I think, how we met.
Yes.
Yeah, he has, what was it called, a give take board? Is that what it was called?
Yeah. The give take board.
Give take board. What a cool idea. I'd never come across it. That was the first time I posted on it,
Yeah.
and somehow you had seen it recently,
Yeah.
and I want to interview somebody about COVID-19 and human behaviors around that. And how did you tell me about how you met Dr. Dan Diamond?
So I went to one of his webinars about leading under pressure.
Ah.
And so when he showed his give take board, I was like, well, what can I find on here that I can help with?
Yeah.
So so yours looked doable. So so I can help with that.
Thank you so much. And yeah, I'm gonna have to tag Dan Diamond in this so he can see what the fruit of his platform
Yes.
and his
Well,
work.
he also pointed out your offer to do some karaoke. And he did say if somebody does that, he wanted to be tagged in whatever turned on with karaoke.
Are you a singer, Katrina?
I could sing if I had to.
Okay, yeah.
I'm in a choir. Well,
oh,
I haven't had a chance to be at the choir recently, but
of course. I'm also a singer, and I was so sad when I heard that. I think it was somewhere in the States that some seniors were in a choir, and
I
they
heard
didn't.
this.
Yeah. What did you hear?
Yeah, I heard it was on the West Coast, so not too far from where you are. And I heard that this group got together and they did good hand hygiene and brought their own sheet music and didn't share anything. But that numerous people from the group that got together came down with COVID. And I heard even a postulate about why that is, that how singing maybe, forces, maybe you need more than 2 meters, like if you're singing, because maybe it generates a bigger sort of airflow and maybe aerosolizes.
Yeah, that's what I heard as well. And it's so tragic that people would come together in a spiritual humanistic act of giving, and unfortunately accidentally spread a virus. It shows how challenging COVID-19 really is.
Yeah.
What is the biggest misconception that you've seen online about COVID-19? Something that you like, I wish those people would stop sharing that.
It's hard for me to put my finger on that. I've done my best to sort of stay off of social media and not hear those stories because I have found it hard enough to deal with all the information I must read that I'm trying to stay away from all of those sorts of optional things. I've heard all sorts of interesting things just as through the rumor mill, even amongst healthcare providers, actually, so many different stories. It's hard for me to pick one. What have you heard?
Well, as someone who's reflective and in a leadership position, there's so much responsibility on me to not spread misinformation, and also to not completely shut down ideas that are innovative that I cannot 100% prove that don't work. But I've heard of people like inhaling hot steam to try to I don't know, and take tons of vitamin C. But then I'll look in the research, and then there are people talking about how vitamin C and then zinc and then all those other things. So I'm just waiting. I'm not a researcher. I'm not good at doing organized science protocols. So I'm going to have to wait on the official stuff for that. But yeah, I just wanted to see if there was anything going on in Halifax that wasn't going on here. Yeah.
No, I can't think of anything real specific.
Okay. What do you find to be the coolest innovation that's come out of COVID-19? And it doesn't need to be a technology. It could be just
There's so many interesting things, in healthcare. As a leader, you get to know that the pace of change in healthcare is generally glacial. Things move very slowly. And so many meetings to discuss something, to then write a memo, and and maybe even the change management of trying to change something is not so good and involves like a lot of sort of failed activity before something actually moves. And then you look at everything that has happened since middle of March, and the rate of change has been absurdly amazing, from just like the telehealth and, things that just took so long before, developing a form, developing an order set, developing a policy or a collaborative plan between units, and things are just rolling out left, right, and center. It's the spirit of like collaboration and like, we need to move now, and things are moving. So there's so many things I hope that we can carry forward. Things that I hope are not like a one-off that are just for the pandemic. There are things I think could be, amazing if we could carry them forward.
Mm. That's I've noticed the same, that changes to how like barriers have been lowered to telehealth, and telehealth
Absolutely.
is such a leveraging current technology, not even future technology, to deliver the health services that we've already been delivering, and the matching billing support for that has accelerated during this time, and physician communities coming together using platforms like Zoom, etc., and WhatsApp to come together and share ideas. I've really enjoyed seeing that's I don't think that's ever going to completely go away. I think that's going to be an accelerated innovation that's going to stay, thankfully.
That's one of the things I hope you're right. Like, I hope that is one of the things that does stay. The spirit of collaboration, just like people coming together, where usually healthcare can be a lot of silos. And just people have really come together to make some incredible things happen.
Did I ever tell you the name of this podcast?
No.
Yeah, it's actually called the Fts Podcast. FTS stands for Fuck the Silos. It's silos keep us sick and they keep us ignorant, and so that's part of what you're on right now. Just so you know, I hope you don't take offense to my provocative language.
Yeah, silos are no good.
You work in the emergency room. So prior to the pandemic, do you feel that you were living the vision that you wanted to live when you were in pre-med, when you were imagining 15 years, 10 years down the line, this is what I'm going to be doing?
I thought about that a little bit, and before I started medical school, I mean, I was a teenager. Like, I didn't know really anything about what my future would look like. And looking back, I obviously recognize in myself the, very sort of naive perception of what medicine was or what it could be. And so, was I living, I asked myself, was I living like my best life, before the pandemic? I feel like I was living my best life about 2 or 3 years ago, and that I have, struggled a little bit in the last couple of years. 3 years ago, my family and I, we took 6 months off. We, just left work. We made no money. We traveled poorly, but worldwide.
Wow.
And we spent 40 nights in a tent.
Wow.
At one point, we traveled for 24 weeks, but we spent 34 consecutive nights in a tent on an olive orchard. And I feel like I was living my very best life right then.
Wow.
And when we came back, I still feel like I was in the zone for at least a year after that. And lately, I just feel like I wish I could recapture the essence of what that was in my working life, because I can't practically just stop what I'm doing. But it was something special.
And that takes so much courage to exit the usual treadmill of work to do something like that. And how did you and your family build up that courage and that motivation to do that? Is that something that a lot of people where you work do?
No, it's true. I it was a series of events. I had been reading books about like garbage and waste and minimalism, and then I ended up doing a couple of medical trips to Haiti, and sort of working in an austere type environment. And I came back from my second trip to Haiti, and I said to my husband, I was like, we kind of hate this house. It's too big. It doesn't fit us at all. The only reason we're not selling it is we're concerned about the market value. It's like, our kids are almost like, at the time, my son was 10. And I said, he's like halfway through his childhood. And if we don't do something now, we're going to miss the opportunity to do it. So we put the house on the market. The first person who saw it bought it. We moved to a much smaller house and then said, okay, well, in 2 years, we are going to go on a trip around the world. That's what we're going to do. And so we spent the next 2 years sort of preparing for that. And it was an interesting, like, I read this book called, as opposed to The Pursuit of Happiness, it was called The Happiness of Pursuit. And the idea was that it's like half the fun of having a goal is the fun of pursuing it.
Yeah.
And so everything we did was going toward, the arc was it's going toward this point. And, some of the most salient moments from that trip are even just the day we left, like what it felt like, how nervous we were, when we closed up the house and like dropped our car off and went to the airport and got on an airplane and said, okay, we'll be back in 6 months. And it was a journey. It was a journey.
It sounds like you really appreciated not the destination, but the journey. Sounds like you were really present in that time.
Yeah, it was really special. It was right before my son, hit that like teenage sort of arsehole.
I don't need you, Mom. He's not going to
Yeah.
watch this. Don't worry.
No, there was this one moment, like, well, more than one, but, there was this one moment where he said to me, thank you for giving me this amazing childhood, is what he said to me. And I was like,
my God,
that's amazing.
Oh, that brings tears to my eyes. That's so beautiful. And it's so beautiful that you did that by intention. You told yourself, I have to give this child a fantastic memory because I'm working my ass off helping other people. And yeah, thank you. That's inspiring.
So I, because of all of that, I feel like they're resilient enough to get through this, to get through this, what they're doing right now. I just really wish I could be a bigger part of it for them. But I also trust that they can do it.
So not only was it a joyful experience, it was a training. It was a life experience, understanding that you can live minimally and almost in a survivalist way.
Yeah. Well, and I just feel like they're so strong and capable. I'm happy for that.
And I think as leaders, looking at our team members, our family members, as being capable of change and adaptation, just as we are, is so key. And when we have faith in that and we transmit that faith in everybody's capability to rise to the occasion, I think the energy, the vibrations that we put off really accelerate innovation, adaptation, and performance. So that's a fantastic message. I wanted to ask, we spoke a little bit about some of the benefits, the innovations that have come out of COVID-19 pandemic. Is there a silver lining to this horrible time where people are, it's really hard to say, and you're on the real front lines of this where you see people being sick and stuff. Is there a silver lining to this for the globe?
I'm sure there is. I some days I have a hard time imagining exactly what the silver lining is, but I am truly surprised and impressed by some of like the profound acts of kindness that I've seen. and just people expressing gratitude. I look at, for example, my brother has 3 little kids, they're 6, 4, and 1. And he and his wife are working from home. And, the 1-year-old is changing like crazy. So I was like, what an amazing opportunity. I know it's hard to not have school and not have daycare, but also like what an amazing opportunity to be together. One of the things that was like so earth-shattering about our 6-month trip is that we spent 6 months together. There was 5 of us every single day, every single night, together. And I feel like that made us really strong as a family. And so I feel like for those families that are struggling, it's a different story. But for many families, this is an incredible opportunity that is actually going to make you stronger. When I look at like in the community, just so many acts of kindness in the community, I really am impressed. And, it doesn't take much to make people weepy these days too.
Yeah.
But it's something crazy I read in just the local news. There's this family who's, every year they put Christmas lights on this really ugly highway side tree. A totally unremarkable, maybe remarkable for how horrible the tree looks, but they put Christmas lights on it every year. And I read that yesterday they put up this huge heart-shaped light to, as a beacon of hope, for people who are driving down the highway, because his wife, who is a retired nurse, has come out of retirement to work during the pandemic. And I just thought, like, just silly things really like that. It's just, they truly are beacons of hope. You walk down the street and you see rainbows and you see chalk art and they're just beacons of hope. And I feel like it makes us, if anything, it makes us a wider human community.
I love that. And I'm seeing that here too. So what was your favorite song to sing in the choir? Did you have one?
I have a recording on my phone, just like a tiny little song, and it's not a known song, but I wish that I could show you the astonishing light of your being.
Whoa!
Isn't that mind-blowing? It's so cool.
That is so cool. And how could people find that recording? Is it online somewhere?
No, I have it as a memo on my phone. I should play it.
maybe you could play it. That sounds so inspiring. So I'd love to hear it.
Yeah, it's just a tiny little thing, but it's so beautiful. It's 1 minute and 20 seconds.
We have time for that.
I wish that I could show you whenever you are lonely or walking in the dark. I wish that I could show you. I wish that I could show you the astonishing light of your being.
Wow.
It's around.
That was beautiful. Thank you so much for sharing that. And
I think it's amazing.
Who wrote that?
It's based on a poem, I think possibly by, Rumi, R-U-M-I.
Oh, yeah, love Rumi.
Yeah. I wish that I could show you, whenever you are lonely and walking in the dark, I wish I could show you the astonishing light of your being. I feel like it could be like a theme song for teenagers.
Yeah. Is Rumi like a Persian or a Iranian?
Persian. I think it is Persian.
Yeah. Well,
yeah.
What a mind, what a timeless artist and human Rumi was. That's fantastic. So cool. It's been such an honor to spend some time with you. Thank you for your courage to come on and give to me and to the world right now through this podcast. And thank you for leading in your department in this really challenging time, Katrina. Do people call you Dr. Hurley, or do they call you Katrina?
I mostly am just Katrina.
Katrina.
Yeah.
And how can people connect with you if they wanted to? Are you on social media?
I am not on social media. I make an effort
You're
to
smart.
avoid it. But, you know, if you ever wanted to get in touch, I work at the IWK Health Center in Halifax.
Okay.
And Katrina.Hurley at iwk.nshealth.ca would be how you would find me.
Okay. Thank you so much for your time.
Thanks,
And
Lauren.
yeah, thank you. And we'll do a karaoke thing another time.
We'll do a karaoke thing sometime. And we'll have to tag Dan Diamond.
Yes, I will.
Okay.
Bye.
Thanks. Bye.
Bye.